Greetings from eMedi News. In the sixth and last module, we will discuss about the hand hygiene. Bacteria on the skin of hands are of two types, resident and transient. Resident are the colonizing bacteria which are normally found on the skin and are also found in the deeper layers of the skin and are difficult to remove. Transient or non-colonizing flora, on the other hand, are present on the superficial layers of the skin and are acquired through accidental contamination. They survive on the skin for less than 24 hours and cannot multiply. They are responsible for most hospital-acquired infections. Unlike the resident flora, transient flora are more easily removed by hand hygiene. Hands of the healthcare workers are the most common route of transmission of bacteria. Hand may become contaminated through direct contact with the patient or through contact with contaminated surfaces or objects near the patient or other healthcare workers. Contaminated hands can lead to cross transmission of infectious agents. Therefore, to prevent transmission, especially when handling vulnerable areas such as surgical wounds, invasive devices, it is important that hands should be decontaminated before and after every episode of direct contact with a patient. Hand hygiene is the single most important, simplest and least expensive method to prevent surgical site infections. Proper hand hygiene interrupts the chain of infection and reduces the chances of transmission of the bacteria from the hands of a healthcare worker. So, when should hand hygiene be performed? Hand hygiene must be performed before and after every episode of patient contact. This includes before touching a patient, before a procedure, after a procedure or body substance exposure risk, after touching a patient, after touching a patient's surroundings. Health hygiene must also be carried out after the removal of gloves. Hand washing is the use of soap and water to cleanse the hand and wrists. Most of us wash our hands frequently, but it is important to know that proper procedure to ensure that the hands are decontaminated. Rings, wristwatches, bracelets, nail paints should be removed before hand washing. Follow these simple steps for effective hand washing. 1. Wet hands with running water. 2. Apply soap to cover all surfaces of the hands. Either plain soap or antimicrobial soap should be used. Thirdly, rub hands vigorously for 40 to 60 seconds, which is done in 6 stages. Stage 1. Rub hands palm to palm. Stage 2. Rub right palm over left dorsum with interlaced fingers and vice versa. Stage 3. Rub palm to palm with fingers interlaced. Stage 4. Rub with back of fingers to opposing palm with fingers interlocked. Stage 5. Rotational rubbing of left thumb clasped in the right palm and vice versa. And stage 6. Rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa. Rinse hand with clean running water. Dry well with a clean disposable towel. Use paper towel, clean towel or your elbow to turn off the tap. Discard the towel after use in an appropriate container without touching the bin lids with hand. Remember, every step is important. Repeat the process if the hands are very soiled. Surgical hand asepsis is required before gloving for a surgical procedure. It eliminates transient flora and reduces resident flora for the duration of the procedure to prevent introduction of organisms into the operative wound if gloves become punctured or torn. Antiseptic agents used for surgical hand asepsis should substantially reduce microorganisms on intact skin, contain a non-irritating antimicrobial preparation, have a broad spectrum of activity, be fast-acting and have a persistent effect. Povidone fulfills all these criteria and has been a trusted agent in maintaining asepsis. Before beginning the surgical antiseptic scrub, rings, wristwatch, bracelets or nail paint should be removed. Remove debris from underneath fingernails using a nail cleaner, preferably under running water. If hands are visibly soiled, they should first be washed with soap and water. Do not use brush. According to the CDC, the use of brush increases bacterial shedding from the hands. Apply enough surgical scrub on the hand. The finger and hands should be scrubbed sequentially from the fingertips to the area just below the elbow in a rotating action. Scrub hands and forearm for 2 to 5 minutes. Rinse hand with running water. Keeping the hands above the elbow to allow the water to drain away from the clean area. Dry with a sterile towel. To summarize, hand hygiene is an important tool to decrease surgical site infection. Adequate hand hygiene eliminates most transient flora and also reduces the surgical flora in the hand of the surgical personnel. Hand hygiene should be used whenever one comes in contact with the patient's skin or his surroundings. It is also very important before surgery. The hand hygiene should be performed in a proper technique to get the best results out of the hygiene procedure. These 6 modules have been prepared to give the colleagues a comprehensive idea about the surgical site infection, its prevention and usage of proper techniques. As said earlier, surgical site infection is a very common cause of morbidity and mortality among surgical patients. Going through all these 6 modules will help our surgical colleagues to have a complete idea of what to do in the given situations when they are busy in their practice schedule and cannot follow other detailed books and recommendations. Adopting this information provided in the module will help them in improving patient care and reducing the cost of the surgical care to the society. We thank you for listening and we hope you will find this information valuable and you will apply to your patients from now on.
So dear colleague, you have gone through these 6 CME modules. To conclude, in this CME, we have discussed various aspects of surgical site infections. It is very important for us as healthcare providers to educate ourselves and understand the significance of preventing surgical site infections, especially in view of rising prevalence of antibiotic resistance organisms, which threatens a return to the pre-antibiotic era. We hope this CME has helped you to better understand how these infections can be prevented. Thank you for participating in this CME. Please complete the post-activity questionnaire that follows. You will get a CME certificate. Thank you.